You're watching TVC Breakfast. Now, for decades, Nigeria's health sector has suffered from acute underfunding, whilst the country's leadership has been accused of going on medical tourism and not paying the needed attention to the sector. Meanwhile, the nation has in recent times witnessed a mass exodus of medical personnel outside the country. They claim their effort in Nigeria is not adequately compensated and hence their profession not respected. Though Nigeria has moved from 187 to 63 in the World Health Organization's recent ranking of health systems, is there a strategy the government can adopt to address the challenges facing healthcare delivery in the country and the huge gap in the funding? That is what we'll be talking about next. So joining us to discuss this, especially as it concerns setting the agenda for the incoming president of the country on tackling Nigeria's health sector. The challenge is Project Director, Legislative Initiative for Sustainable Development, Gafar Alawode. It's nice to have you join us this morning, Gafar.
Good morning. Thank you for having me.
Right, good morning. Now, when it comes to the health system, we often make reference to the Western standards of health system as the benchmark. So every country benchmarks the efficiency of the health system against the West. But are there some peculiar things that are unique to what we have that we could have taken advantage of?
Okay, thank you very much. Once again, thanks for having me. I think before I come to that specific question with regards to specific things that we can take advantage of, I would like to call our attention to the fact that
it seems we have lost your audio there, Gafar.
Hello, can you?
Okay, we'll certainly expect the audio to be back soon so we can hear him talk to us regarding this. The point there is a great thing of concern, the health system in the country, not just even the health. We have the education, we have, agriculture, we have the various sectors in the country. But health is wealth, like they say. And the moment you don't have it, all the systems put in place, you can always not expect a very thriving and working economy because the people are actually the economy. The people are the market.
Whoever becomes the president definitely has his work cut out for him because we're looking at
I think we have Gafar back right
great.
now. All right, Gafar, let's have you. You were saying something before we lost your audio.
Okay, thank you very much. I hope you can hear me now.
We can hear you loud and clear. Take it away.
Oh, okay, thank you very much. Once again, thanks for having me. I think what I was trying to emphasize earlier on, probably because before we come to the issue of health system peculiarities, I think what is very, very important is to understand what works in terms of transforming the health system. Whether in the developed world or in the countries like third world countries like ours, I think the global consensus in terms of the parameter for standard for progress in health is universal health coverage, which means everybody should have access to needed quality care without suffering financial hardship in the process of doing that. So in terms of making progress along putting the country on that trajectory, the process starts as a political process, not necessarily a technical process. So setting the country on the trajectory of universal health coverage is you need the ethical and political consensus that you have to do that. And let's look at a country as diverse as Ghana, as Rwanda, as Malaysia, as Turkey. What did they do differently to put them on the trajectory of universal health coverage? They took advantage of the policy reset window that comes with election to put universal health coverage on the political front burner, where parameters are actually defined in terms of engaging the political class to clearly define the targets for the universal health coverage for the health system, target in terms of how many people do you want to cover with a universal health coverage scheme? How do you want to reduce, increase skilled birth attendance, for instance? How do you want to increase the number of children that are fully immunized, and several other parameters like that in the health sector, which is clearly defined. Then the next thing is that to clearly define what are the area of our policy strategic shifts, because you cannot continue to do things the same way and expect a different result. So I think those are the things that are actually very, very important. And looking at where we are, it is very unfortunate where we are. We have made some progress, but we are not there yet in terms of what we can achieve given our financial and human resource potential. So that is why some of us, some people in the country, a wide area of stakeholders, from partners for development partners, from civil society, donor agency, come together to form what they call Universal Coverage 2023 Forum, which is trying to do something different this time around, to try as much as possible to create a citizen-led health agenda, which will be used to engage the political class, as the political parties, and their flag bearers are developing their manifesto, to engage with them, to be able to advise in terms of what should be the priority, in terms of target setting, what should be the priority in terms of clarity around, for example, so we are going to another political cycle, 2023 and 2027, hopefully. So at the end of that cycle, what do we want to see in terms of a number of Nigerians that are covered by a financial protection mechanism, like this time around health insurance? It is as low as like 5% of Nigerians this time around. So we want to see a clear target being set by the presidential candidate, the governorship candidate, their political parties, in terms of how many Nigerians do you want to cover, what percentage. We want to see clear target in terms of, for example, the skilled birth attender, which is a proportion of deliveries that are being attended to by skilled professionals, which is as low as 43% now. We want to see where they want to take it to, and other parameters like even the immunization, some basic ones. And don't let us forget health security, which is very, very important. We are all living witness to what happened as a result of COVID. And then assessment has been done of our preparedness for pandemics, which scored Nigeria at 46, used to be 39 like a couple of years ago, a slight improvement. So we want to see a clear target being set by the political class in the next years to what we want to achieve. We are currently at 46. What do we want to be 2027, for instance? So that there is a very, very clear target being set by the political class. And our group, US 2023 Forum, we have tried as much as possible to develop this citizen-led health agenda, where we as an advice, try to articulate some indicators where we want to be in 2027, for instance, which could be adapted by the political class when they are creating their health manifesto. And I guess another important thing to do is to look at what strategic policy shifts do we need.
Mr. Gafara, let me ask what's the level of our engagement, the level of your engagement, your group's engagement with the political class in achieving or, drawing out clear-cut targets in the healthcare sector?
Okay, very good question. So actually, there's a process that we actually mapped out, and the process started last year with a summit where we brought stakeholders together to discuss the universal health coverage quest of Nigeria, to look at what are the issues, what are the challenges. And one of the outcomes of that is that we need a clear citizen-led health agenda, which led us to the development of this citizen-led agenda through a very participatory process. And interestingly, we had a representative of major political parties at that workshop, and they alluded to the fact that probably this is the first time this type of engagement is happening, where we, through a co-creation process, we try to identify what should be the priorities in terms of target, what should be the priorities in terms of the policy issue. But it won't end there, and I'm happy to tell you that we are collaborating with an international policy think tank, Chatham House, which has a very strong convening power. So the next process is that, the parties have just concluded their primaries, the candidates just emerged. The next process is to start engaging the political parties again and start engaging the flag bearers and try as much as possible to scrutinize what they have already in terms of a manifesto, and to look at what are the gaps, what are the challenges, how do we improve on this manifesto to make it a very measurable one, to ensure that it speaks to the real issues in terms of a policy. And if you allow me, I will quickly say one or two things with regards to key policy shifts that need to happen in Nigeria. We cannot just say we want to achieve universal health coverage without addressing some key strategic policy shifts. And one of them is the resource and policy optimization. What do I mean by that? So if you look at the money we spend on health, the health workers that are working in the health sector, the equipment that we are using, and the policy, we're actually not getting the best out of those policy and human resources. Let me talk about policy optimization. There are a number of policy trusts that are not being implemented today, even policy trusts that are backed by law that are not being implemented. And one example is the National Health Act of 2014 makes provision for certificate of standard, which describe the standard of medical healthcare provision in Nigeria at all levels. And if you want to operate legally, whether public or private institution, you need to obtain the certificate of standard. It's by law. But unfortunately, that is not being implemented. You can see a lot of mileage that Nigerian health system can actually achieve if that is being implemented. Another very strategic policy trust is the same National Health Act made provision for the Honorable Minister to prepare annual State of the Health report, which details in terms of amount of resources earned and policy implemented, and in terms of results achieved as well, which could form the basis for scrutinizing the system and holding the system accountable. That is not being implemented. If you look at even how we spend money in health, even the little resources, so during the introduction, we talk about health systems is grossly underfunded. Very, very true. But that is half of the story. Even the little resources that we are spending, we're not getting the best out of it in terms of how we budget for health. For instance, when you look at the budget for health, you'll be struggling to see what amount of health do you want to buy with this money that you are spending. So it has to be very, very clear. So we have to shift from what they call input budgeting to more of a result-based budgeting, which will show clearly this is what we want to achieve. If you look at our human resource for health, there are a lot of challenges for that. But we are not very effective in managing even the one that are yet to leave the country, because you talk about attrition the other time. The one that have not yet left the country, we are not getting the best out of, because we did not deploy a sort of evidence-based management using data to look at how many do we have, what are they doing, what is their productivity, what is the performance like. So number one area is to policy for the health manifesto to clearly articulate how do we get the best out of existing resources. Then we now go to how do we mobilize additional resources. And that is what I call sustainable financing and strategic investment. Like you rightly alluded to earlier on, Nigerian health system is grossly underfunded. The health financing landscape is characterized by suboptimal public investment, which translate to suboptimal access to care that we've seen. But in terms of what needs to happen, okay, Nigeria government, this present administration has done a relative great job in terms of ensuring what they call basic care provision fund is implemented. But if you look at the capacity of that funding pool, the size of the Nigerian that you cover is very, very low. And that is why Nigerian government needs to look at other sources of funding health in Nigeria. So, like for example, there's this telecom tax that people have been talking about. Unfortunately, it was removed from the version of the National Health Insurance Authority that was signed. So we need to look at other areas, like for example, recently the beverage tax in terms of tax on sugary non-alcoholic drink was introduced. So we have to look at all those areas and look at even the amount of money that we are allocating on annual basis. We are doing only like 4 to 5%, where the Abuja Declaration is talking about 15%. Only less than 1% of the GDP is spent on health by government.
All right.
While the benchmark is that we should spend like 5%. So we need to look at mobilizing where additional money will come from. But not only that, where will this money go?
Hello, I want to ask you a question that, we've seen all these things, all these minutiae of details you have been rolling out, but there's something fundamental about our health sector. Is it hypocrisy or is it practicality that some our elites always go abroad to get their treatment? While is it possible for us to even get any solution to it if we don't look in and make sure that there's some kind of legislature about getting treatments abroad? Because all that you have said, they have been written one way or the other in policy statements, in seminars, in newspaper articles, in political discussions like this, and nothing happens because the elite focuses on getting treatment abroad. During COVID, when it was impossible for them to go abroad, we saw some tragedies here at home where prominent Nigerian elite died in Nigerian elite hospital. So I think maybe we need to address the issue of indigenizing or domesticating our Medicare first at all levels before talking about all of these details you just reeled out.
Well, I think what is important is for us to understand why people choose to go abroad in the first instance to access health care. Because, if you want to access good quality care that is not available locally and you have your resources, I think the first instinct is to think of healthcare, where to go. And let me give you an example of somebody that is suffering cancer. In Nigeria, we have only 6 comprehensive cancer centers, which are not operating optimally. You see people that require a radiotherapy, for example, queuing endlessly in a tertiary hospital, where they are not able to cater for them. Is that the machine is down? Is that the personnel is not there, and all those stuff like that? Now tell me, what is going to be the moral justification for even somebody like that has the resources to treat himself elsewhere? I think what is important, let's try as much as possible to introduce legislation that is, that is easy to implement, and let's address the root cause of issues. If you try to reposition our tertiary healthcare system today with the necessary funding, it's going to be a lot cheaper for anybody to access care, tertiary care in Nigeria locally than going abroad. And principle of economics, how many people want to waste their resources and all those stuff, and coupled with the fact that even when some of them travel abroad, they are going to meet Nigerian practitioners there, treating them and everything. I think what is more important before we put in legislation that people must not go abroad don't forget one thing that will happen. If you say people should not go abroad, you introduce legislation and everything, you discover that, some people even providing the care will decide to come and provide the care for only the rich and vulnerable in the country and all those stuff like that. So what is important is to reposition the system, to strengthen the system in the sense that we reposition our healthcare system from primary to tertiary and try to improve the funding and raise the accountability bar. And that was why I talk about the state of the health report for the institution to give necessary update in terms of even the little resources they have used, and for the citizen to be engaged in terms of knowing what is happening in the health sector, asking our question. Our legislature should be alive to their responsibility in terms of providing the necessary oversight, looking at the money that government is spending. Those are the paradigm shifts that we need to ask.
It looks like what you are saying is that this is not possible to have great health care in Nigeria because the elite will always have a way to take care of themselves. And if they can take care of themselves, we can never have health care at any level in Nigeria, because they will not provide for the cancer centers, they will not provide for the tertiary or even the primary healthcare levels, because we have been saying all of this for decades and decades and decades, and we have, as you said, cancer centers where nobody should queue to go and get their healthcare if they have money to go abroad. So it's almost like we can come up with policies all we want, the elite will go abroad all they want, we cannot make any laws against them, so what's the point? And Abacha, when they plotted a coup decades ago, 1983, they said our hospitals are consulting centers. Even those who consulted, the doctors, are also leaving.
Okay, I think what is going to be different. I believe to turn things around, you have to do different things and do things differently. Like I said earlier on, what is different this time around is that the health has not been on the political agenda before now. That's the truth of the matter. In terms of the political leadership, really understanding the situation of health system. Let me give you an example. We had, recently we saw a very senior government official during COVID making pronouncements that probably never knew that our health system was this bad. And you know, some of us have engaged a number of governors in the past few years. You know, it was alarming to them when we put the statistics to them in terms of the state of health. I think what we are trying to do this time around is to raise the political profile of health to the extent that the political class, we see it that it is very, very important, and it's a very important policy thrust. It's going to be on the real agenda, to address some of these health issues. And what is the demonstration of commitment to health? Demonstration of commitment to anything in life, probably number one there is state of financing. And like I said, it's not only enough to put more money, to identify where more money will come. We need to raise the accountability bar, to ask questions that, so the government have their own role to play, the civil society, even the citizen have a very important role to play. So to me, what is going to change is a government that is starting in 2023 that has a clear target in terms of key parameters, what to achieve in terms of number of people to cover, percentage of women that will be delivering through skilled birth attendant, immunization coverage, state of our tertiary health facility, and health security. And again, with a policy trust to actually support all those targets, which will be used to hold them accountable. Because the truth of the matter is that, is that a previous government, what exactly do you want to hold them accountable to? What did they promise you? So that is what the commitment we want to seek from government this time around, that you continue to use it to hold them accountable.
Right, Mr. Gafar. But then, okay, so this sounds brilliant, but where do the people come in? How do they hold the government accountable? How do they hold the people they will vote for accountable if indeed the health agenda, that will be priority now, if this health agenda is incorporated into the campaign manifestos? Do we go to court to hold them accountable? Not forgetting that even our laws put health as, non-justiciable. That is even a battle that people are still fighting, going to court to make governments provide for healthcare delivery. That also seems to be phantoms somehow.
Okay, so you're asking a very, very important question around accountability. I think the first stage in the process of accountability is transparency, to know what we want to hold government accountable for. Like I said, we have settled the first stage in terms of clarity around the target, around the policy trust. But at the same time, don't forget that all of us have a role to play, including the media, including the legislature, have a very important role to play in terms of holding government accountable. And part of what we are doing to achieve that is that next week we're having a workshop for the media sensitize them, deepen their knowledge on this concept of universal coverage, health agenda, and everything. So that from time to time, they ask questions at midtime, at every time. When you are asking questions, when you are engaging with the political class, the governor, the president, you are asking them based on the commitment you've already said. You ask questions. Then don't forget that what our lawmakers are supposed to be doing, accountability is a key part of their work. They are supposed to look at this state of the health report that I mentioned earlier on, invite the honorable minister, interrogate the presidency as much as possible, and the same process being replicated at subnational level. So that is what is going to be different. And again, the civil society. We have a lot of civil society organizations that organize a lot of programs, and then this health agenda, that will serve like a charter, will form the basis for asking questions. And don't forget about the political accountability. Probably we are not fully there in Nigeria, where government will be voted in or voted out as a result of their performance in health. But gradually it's moving that. So in terms of when government is giving appraisal or giving account of their stewardship, it's not just telling us, I've built this number of hospitals, I've built number of this road. We're assessing their performance against these parameters. Of course, things will not change overnight, but I think we believe it's the beginning of a process that will take us somewhere.
All right. We have to leave it here now. Gafar Alawode, thank you so much for talking to us on TVC Breakfast.
Thank you very much.
Great.